हाँ जी, ਵੈਲਕਮ ਕਰਦੇ ਹਾਂ ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਨਰਸਿੰਗ ਕਰੀਅਰ ਚੈਨਲ ਦੇ ਉੱਤੇ। ਸੋ ਸਾਰਿਆਂ ਨੂੰ ਪਲੀਜ਼ ਰਿਕੁਐਸਟ ਆ ਵੀ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਜ਼ਰੂਰ ਕਰ ਲਿਆ ਕਰੋ, ਜਿਹੜੇ ਵੀ ਸਟੂਡੈਂਟਸ ਨੇ ਹਲੇ ਤੱਕ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਨਹੀਂ ਕੀਤਾ, ਕਿਉਂਕਿ ਨਰਸਿੰਗ ਕਰੀਅਰ ਚੈਨਲ ਦੇ ਉੱਤੇ ਆਪਾਂ ਸਟਾਫ ਨਰਸ ਦੇ ਰਿਲੇਟਡ ਜੋ ਵੀ ਐਗਜ਼ਾਮ ਹੁੰਦੇ ਨੇ ਸਾਰਿਆਂ ਦੀ ਪ੍ਰੈਪਰੇਸ਼ਨ ਕਰਵਾਇਆ ਕਰਾਂਗੇ। ਚਲੋ ਸਟਾਰਟ ਕਰਦੇ ਹਾਂ ਫਸਟ ਕੁਐਸਚਨ ਦੇ ਨਾਲ। ਜਿਹੜੇ ਇਹ ਕੁਐਸਚਨ ਆਨਸਰਸ ਨੇ ਇਹ ਸਾਰੇ ਕਵਰ ਕਰਵਾਉਣ ਦੀ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਆ MCQs ਦੀ ਮੋਸਟ ਇੰਪੋਰਟੈਂਟ ਟੌਪਿਕਸ ਦੇ ਵਿੱਚੋਂ MCQs ਨੇ। ਸਟਾਰਟ ਕਰਦੇ ਹਾਂ ਫਸਟ ਕੁਐਸਚਨ। Who discovered the transmission of malaria by Anopheles mosquito? ਸੋ ਜਿਹੜਾ ਟਰਾਂਸਮਿਸ਼ਨ ਹੁੰਦਾ ਆਫ ਮਲੇਰੀਆ ਦਾ ਐਨੋਫਿਲਾਈਸ ਮੋਸਕੀਟੋ ਦੁਆਰਾ, ਸੋ ਉਹ ਕਿਹਨੇ ਡਿਸਕਵਰ ਕੀਤਾ ਸੀ, ਕਿੱਥੋਂ ਪਤਾ ਚੱਲਿਆ ਸੀ, ਕਿਹੜੇ ਸਾਇੰਟਿਸਟ ਨੇ ਇਹਦੀ ਡਿਸਕਵਰ ਕੀਤੀ ਸੀ? A. ਰੋਨਾਲਡ ਰੌਸ, B. ਲਵੇਰੀਅਨ, C. ਮੁਲਰ, D. ਰੋਬਰਟ ਕੋਚ। So here are the options and the right answer is Ronald Ross. Move to the second question. Which of the following disease is known as barometer of social welfare? So ਇਹਨਾਂ ਚੋਂ ਕਿਹੜੀ ਡਿਸੀਜ਼ ਆ ਜਿਹੜੀ ਬੈਰੋਮੀਟਰ ਆਫ ਸੋਸ਼ਲ ਵੈਲਫੇਅਰ ਦੇ ਨੇਮ ਨਾਲ ਜਾਣੀ ਜਾਂਦੀ ਆ? A. ਟਿਊਬਰਕਲੋਸਿਸ, B. cholera, C. leprosy, D. malaria. So tuberculosis is a disease which is also known as barometer of social welfare. Third, 3-day disease is a dash. A. rubella, B. rubeola, C. roseola infants, D. measles. So 3-day disease is a rubella. A is the right answer. Next, fourth, living standard of people is best assessed by A. infant mortality rate, B. maternal mortality rate, C. physical quality of life index, D. death rate. ਸੋ ਜਿਹੜੇ ਪੀਪਲ ਨੇ, ਲਿਵਿੰਗ ਸਟੈਂਡਰਡ ਆਫ ਪੀਪਲ ਨੇ, ਉਹਨਾਂ ਨੂੰ ਬੈਸਟ ਅਸੈਸ ਕੌਣ ਕਰ ਸਕਦਾ? ਫਿਜ਼ੀਕਲ ਕੁਆਲਿਟੀ ਆਫ ਲਾਈਫ ਇੰਡੈਕਸ। C is the correct option. Next, fifth question. Most universally accepted indication of health status of whole population and their socio-economic condition among the following is A. MMR, B. IMR, C. life expectancy, D. disease notification rates. So most universally accepted indicator of health status of whole population is infant mortality rate. B is the right answer. Sixth, Sullivan index indicate. So what is the Sullivan index indicate? A. life free of disability, B. hookworm eggs, and C. standard of living, D. pregnancy rate per HWY. So the right answer is life free of disability indicates Sullivan. Next, seventh, silent epidemic of the century is. What is the silent epidemic of the century? A. coronary artery disease, B. chronic liver disease, C. chronic obstruction lung disease, and D. Alzheimer's disease. So the right answer is Alzheimer's disease. Eighth, in liver, bacteria that found their way into postural circulation is destroyed by A. cilia, B. hydrochloride acid, C. leukocytosis, D. Kupffer cells. So in liver, bacteria that found their way into postural circulation is destroyed by Kupffer cells. Ninth, causative agent is present but there is no transmission is known as A. elimination, B. control, C. eradication, D. wholly endemic. So right answer is elimination. 10th, pap smear test for detection of carcinoma of cervical. Which level of prevention is A. primordial, B. primary, C. secondary, D. tertiary. So it's a secondary prevention. 11th, in India, death has to be registered within A. 3 days, B. 7 days, C 14 days, and D 21 days. So death is registered within 21 days. So काफ़ी बार ਇਹ एग्जाम ਦੇ ਵਿੱਚ ਆਇਆ क्वेश्चन, ਇਹ ਧਿਆਨ ਨਾਲ याद रखियो भी ਜਿਹੜੀ ਡੈਥ ਰਜਿਸਟਰਡ ਹੁੰਦੀ ਆ ਉਹ 21 ਡੇਜ਼ ਹੁੰਦੀ ਆ। 12th, the duration of quarantine is A longest incubation period, B shortest incubation period, C infective period, D none of the above. So duration of quarantine is longest incubation period. 13th, strain used for BCG vaccine is A Edmonston Zagreb strain, B Oka strain, C Danish 1331, D RA 27/3 strain. So the right answer is Danish 1331 for BCG vaccine strain used. 14th, the risk of cold chain failure is greatest at regional level, district level, primary health center level, and the last is sub center and village level. So right answer, sub center and village level. Risk of cold chain failure is at sub center and village level. 15th, adjuvant used in DPT is A silica, B magnesium, C manganese, D aluminium. Right answer is D. 16th, which of the following is the best source of vitamin 12? A green leafy vegetables, B broccoli, C cauliflower, D meat and dairy products. So main source of vitamin K is meat and dairy products. 17th, minimum gap that should be allowed between to administer 2 live vaccines. So what is the minimum gap? A 2 weeks, B 4 weeks, C 2 months, D 4 months. So the gap that should between to administer 2 live vaccine is a 4 weeks. 18th, the ability to influence other people is called A leadership, B management, C decision making, D supervision. So right answer is leadership is the ability to influence other people. 19th, epidemiological threat contain all except A agent, B manpower, C host, D environment. So in epidemiological threat, agent, host, environment are included but except manpower. B is the right answer. 20th, fiberoptic scopes are sterilized by A glutaraldehyde, B ethylene oxide, C autoclaving, D alcohol. So fiberoptic scopes are sterilized by glutaraldehyde. A is the right answer. 21st, postural hypertension is defined as fall in systolic blood pressure by mmhg or diastolic by dash mmhg within 3 minutes of standing from a supine or sitting position. So what is the main diastolic and systolic blood pressure? A 20-10, B 10-20, C 10-10, D 20-20. Right answer is 20/10. 22, the thermometer in which the result is seen within 45 seconds is A electronic thermometer, B clinical thermometer, C disposable thermometer, D tympanic membrane thermometer. So this is very easy question. ਇਹਦਾ ਆਨਸਰ ਤੁਸੀਂ ਕਮੈਂਟ ਦੇ ਵਿੱਚ ਦੱਸਣਾ। ਨੈਕਸਟ ਚੱਲਦੇ ਹਾਂ 23 ਤੇ। The Indian Nursing Council Act was proposed in A 1945, B 1947, C 1958, D 2001. So Indian Nursing Council Act was proposed in 1947. B is the right answer. 1947. 24th, The principles of primary health care includes A. Equitable distribution, B. Community participation, C. Coverage and accessibility, D. Appropriateness and continuity. So principles of primary health care: equitable distribution, community participation, and coverage and accessibility. So the right answer is A. A, B, C, and are the correct options. 25th, the use of sense of smell to gather data in physical examination is called A. Auscultation, B. Olfaction, C. Percussion, D. Palpation. The use of smell to gather data in physical examination is called olfaction. B is the correct answer. 26th, the side effects of antidepressant result: A. Dry mouth, different in micturition and constipation, B. Epileptic seizures, tremors and muscle twitching, C. Skin rashes and jaundice, D. Somnolence and orthodontic hypotension. So the right answer is dry mouth, different in micturition and constipation, epileptic seizure, tremor and muscle twitching, and the last is skin rashes and jaundice. So right answer is A, option A, B, C. 27th, the type of fever in which temperature fluctuate more than 2 degrees Celsius, all about normal, during a 24-hour period is dash: A. Intermittent fever, B. Remittent fever, C. Recurrent fever, D. Relapsing fever. So the answer is remittent fever. 28. The main substance that are excreted from the fetus is dash: A. Bilirubin, B. Carbon dioxide, C. Uric acid, D. Tissues. So carbon dioxide is the main substance that excreted from the fetus. 29th, in verbal communication, which of the following reflects the feeling behind the words? A. Pace and rhythm, B. Timing and relevance, C. Posture and gait, D. Intonation. So in verbal communication, reflects the feeling behind the words is intonation. D is the right answer. 30th, if there are 25 bottles of intravenous fluid per day and 25 injections are given, then how many months will be total supply last? 3 days, 5 days, 6 days, and 8 days. Right answer is 3 days. A is the right answer. 31st, find the correct spelling of hemorrhage. So this is very easy question. Find the correct spelling of hemorrhage is D. HEMORRHAGE. This is the correct spelling of hemorrhage. 32. The practical nursing programs were developed during the dash: A. First half of century, B. First half of 20th century, C. Second half of 19th century, D. Second half of 20th century. So practical nursing programs were developed during the first half of 20th century. 33. The suction of the internal fluids of the corpus and the injection of embalming chemicals into body cavities using an aspirator and trocar is the method of A. Surface embalming, B. Cavity embalming, C. Hypodermic embalming, D. Arterial embalming. So B. Cavity embalming. ਸੋ ਇਹੀ ਅੱਜ ਦੇ ਮਲਟੀਪਲ ਚੋਇਸ ਕੁਐਸਚਨ ਸੀ, ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ ਟੌਪਿਕਸ ਦੇ ਵਿੱਚੋਂ ਐਂਡ ਕੁਛ ਕੁ ਬੁੱਕ ਦੇ ਵਿੱਚੋਂ ਲੈ ਕੇ PDF ਬਣਾ ਕੇ ਅਪਲੋਡ ਕੀਤੀ ਹੈ ਵੀਡੀਓ। ਉਮੀਦ ਆ ਤੁਹਾਨੂੰ ਸਾਰਿਆਂ ਨੂੰ ਇਨਫੋਰਮੇਸ਼ਨ ਇੰਪੋਰਟੈਂਟ ਲੱਗੀ ਹੋਊਗੀ। ਸੋ ਸਾਰਿਆਂ ਨੇ ਵੀਡੀਓ ਨੂੰ ਲਾਈਕ ਅਤੇ ਸਬਸਕ੍ਰਾਈਬ ਚੈਨਲ ਨੂੰ ਜ਼ਰੂਰ ਕਰ ਲਿਆ ਕਰੋ। ਅਤੇ ਓਕੇ ਬਾਏ, ਥੈਂਕ ਯੂ ਗਾਈਜ਼।